Good day, my name is Danielle, Louise Villaseñor from BSN 1B, and for this video, I'll be performing physical assessment of the thorax and lungs. For the physical assessment, a comprehensive health assessment gives nurses an insight into the patient's physical status through observation, measurements of vital signs, as well as self-reported symptoms. This also includes medical history, a general survey, and a complete physical examination. For the preparation, you're going to have to assemble the equipment and supplies needed for this procedure, such as the stethoscope. Second, you're going to provide for client privacy. In women, drape the anterior thorax when it is not being examined. You're also going to have to determine the following history of the client. First, their family history of illness, including cancer, allergies, or tuberculosis. You're also going to have to determine their history in their lifestyle habits, such as smoking or occupational hazards. You're also going to have to determine the client's history on medications that they are taking.
Good evening po ma'am, my name is Danielle, Villaseñor. I'm your student nurse from NEUSTCON. So first po, may I know your name please?
My name is Kali Macaso.
Okay po, Miss Kali. So Miss Kali, ang gagawin ko po ngayon is i-check po natin yung inyong thorax and your lung area. So we're gonna do a physical assessment po sa inyo. This will help us determine if normal lang po ba yung sa may lungs nyo. So is that okay with you po?
Okay lang sa akin yun.
Okay po ma'am.
For the implementation, inspect the shape and symmetry of the thorax from posterior and lateral views.
Okay lang po, nakaupo po kayo.
Second, inspect the spinal alignment for deformities. Next, palpate the posterior thorax. For clients who have no respiratory complaints, rapidly assess the temperature and integrity of all chest skin. For clients who do have respiratory complaints, palpate all thorax areas for bulges, tenderness, or abnormal movements.
Okay po ma'am, so check ko po muna likod ninyo. So, ma'am, do you have any difficulty with breathing po?
Wala naman, okay lang ako sa paghinga.
Wala po kayong hindi po nahihirapang huminga, wala po kayo na.
Wala, okay lang.
Next, palpate the posterior thorax for respiratory excursion. Place the palms of both of your hands over the lower thorax with your thumbs adjacent to your spine and your fingers stretched laterally. Ask the client to take a deep breath while you observe the movement of your hands and any lag in movement.
Inhale po ulit, inhale. Exhale. Inhale.
Then you're going to palpate the thorax for bronchial or tactile fremitus.
So, may sasabihin po ang mga salita. Paulit na lang po. Paulit-ulit po sabihin ng mga salita. Sabihin niyo po, blue moon, blue moon. May diretso lang po.
Blue moon, 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 blue moon. Blue moon, 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 blue moon.
Next, you're going to percuss the thorax. Percussion penetrates to a depth of about 5 to 7 centimeters. It detects superficial rather than deep lesions.
Keep your arms across your chest lang po. Okay po. Sweet na po ako.
Percuss in the intercostal spaces for about 5 centimeters interval in a systematic sequence. Compare one side of the lungs with the other and percuss the lateral thorax every few inches starting at the axilla working down to the 8th rib. Auscultate the thorax using the flat disc diaphragm of the stethoscope. Use the systematic zigzag procedure used in percussion. Ask the client to take slow, deep breaths through the mouth. Listen at each point of the breath sounds during a complete inspiration and expiration. Compare your findings at each point with the corresponding point on the opposite side of the thorax.
Ayan, normal lang ba ako?
So far naman po ma'am, okay naman po yung sounds ninyo. Lang sounds ninyo. Okay po. Okay po, so far naman po, normal naman po yung na-assess ko po sa inyo.
Okay, that's good to hear.
Opo, that's good po. Okay. So, yun lang po ma'am. Do you have any questions for me po?
Wala naman na.
Okay po. Okay po ma'am. So, good night po. Thank you po.
Thank you din.
For the documentation, you're going to have to document your findings in the client's record in the forms or checklists that can also be supplemented with narrative notes when appropriate. You're also going to have to report any deviations from the normal or expected outcomes to the primary healthcare provider. That is all for my video. Thank you for watching.